you a new grad nurse gearing up for your first big interview? In today's video, I'm going to give you some practical tips on how you can ace your nursing interview and land at your dream job. So let's get right into it. For those of you who are new to the channel, my name is Pawan. I'm a registered nurse based in Sydney, Australia. I graduated in December 2017 and have been working as a registered nurse ever since. First things first, do your homework. Research about the hospital or the facility you're applying the job at. Don't just rock up knowing nothing about the organization. Hop on their website and learn about their mission, their values, and any recent news. Why? Because hiring managers love candidates who show that they actually care about the organization they're applying the job for. And here's a pro tip. If you mention one of the mission values in your answers, you'll instantly stand out. Now let's take New South Wales Health as an example. So I'm quickly going to hop on their website and see what their mission and their values are. New South Wales Health mission. So let's click on this one because it's a PDF, so we can easily go through the PDF. There we go. So they have a vision. Our vision is for a sustainable health system that delivers outcomes that matters to patients, is personalized, invests in wellness, and is digitally enabled. So that's New South Wales Health's vision. Some organizations will have a mission, whereas some will have vision. It's same thing. And the core values are right here: collaboration, openness, respect, and empowerment. And they have a little explanation down the bottom as well. So if you try and incorporate one of these values in your answers, you will get bonus points for it. Because without even having to ask you, you are already stating their values in your answers, which shows that you have done your research, you've done your homework, and you are a well-prepared candidate. The second tip is know your why. Every interviewer will ask you some version of the same question. Why do you want to be a nurse? Why do you want to work at our hospital? This is your chance to show your passion. So instead of giving a generic answer like I love helping people, try something more personal. For example, I became a nurse because I saw how compassionate nursing care transformed my grandmother's experience in the hospital, and I want to provide the same for my patients. See the difference? Personal stories make you more memorable. So try and come up with a story that resonates with you, why you chose the nursing career, and then state it in your answer. Because if they do ask you this question in the interview, then you're not rambling and just saying some generic stuff. You have a personal story to back it up with. Tip number 3, master behavioral questions. Now let's talk about those tricky tell me about a time questions. The best way to answer those questions is using the STAR method. S stands for situation, which is where you set the scene and tell them the scenario you were in. T stands for task, which means what was your role in the whole scenario. A is for action. What did you do about the situation? How did you solve the problem? And R stands for result. What was the outcome of the situation? For example, let's say that they ask you that, tell me about a time when you had a difficult patient. So instead of saying, oh, once I had a cranky patient and this is what I did and just rambling about it, use the STAR method. During my clinical placements, I had a patient who was very anxious about his treatment plans. I was looking after the patient along with my primary nurse. I took the time to listen to the patient and his concerns and explain to him in simple terms what the treatment plan involved and the rationale behind the doctor deciding for the plan. By the end of the conversation, he agreed to the care plan and thanked me for my patients. That answer, gold. So every time you get a behavioral question, make sure to follow the STAR technique. It actually helps you streamline your thoughts as well and form a concise answer. So while you prepare for your interview, make sure to practice a few using different behavioral questions that you might be asked in the interview. Tip number 4, be ready for clinical questions. Yes, they might test your clinical knowledge as well. You don't need to be perfect at this, but they just want to see your critical thinking skills. For example, let's say they ask you, what would you do if your patient's blood pressure suddenly drops? So even if you're unsure, just talk through your thought process. So first, I would check the patient's vital signs and assess for any symptoms. And I would lower the head of the bed down with his legs slightly elevated. And I will let the team leader on the ward know and probably also get a clinical review by a doctor. And I would also prepare for interventions like intravenous fluids and medications. So even if you don't nail the answer, showing logical thinking is the key. Tip number 5, ask smart questions. At the end of the interview, they will always ask you, do you have any questions for us? Never say no. Instead, have some thoughtful questions prepared, like what kind of support will I have as a new grad during the transition period? Or what does success looks like for a new grad in this role? This shows that you're serious about the job. I remember during my new grad interview, I also asked them the question of when will I hear the outcome of this interview? It's not a super thoughtful, but it's not a super smart question to ask, but it's a genuine question. And you don't want to be left wondering when would you hear the outcome of the interview. So something like that is also worth asking. And I remember during my new grad interview, I also made sure that they knew, because I was an international student who recently graduated. So I wanted to make sure that they know that I'm not seeking sponsorship, because the hospital I was applying the job at, they had it on their website that we don't sponsor international students for work visas and stuff. So this is something I wanted to make sure that they know that I'm not seeking sponsorship. So if you are an international student and if you've studied in Australia, you you definitely don't need sponsorship. So mentioning that in the interview at some point is also beneficial, because that way that gives you a green light kind of thing. I mean, you don't really have to, but this is something I did, so I wanted to share it with you. And I was one of the rarest new grads who got into the new graduate program straight away, right after I finished my degree, as an international student, I mean. And I was pretty proud of myself for that. So try and have 1 or 2 thoughtful questions ready before you go for the interview, because it shows that how serious you are about this job. Now that you're ready to crush the nursing interview and get your job offer. But make sure to do some mock interviews with your family members or friends just to get in the reps so you're comfortable answering the questions. And if you're wondering how much does a new graduate nurse make sure you check this video out, where I've shared my own payslip from when I was a new graduate nurse. That will sort of give you an idea of what your pay rate would be like today. So I wish you all the best with your interview, and I'll see you in the next video. Bye.